Maya Fraser. Hi.
Hello, Carla.
Hi. So you're another professional arts therapist.
Yes, yes. So yeah, I've been accredited since 2013 now. So
Yeah.
yeah.
Okay. And so where do you live and work?
I live in a rural town called Morwell, which is in the Latrobe Valley in Victoria.
Right. Okay. And are you working with an organisation at the moment?
Yes, I am. I'm working at Latrobe Community Health Services, where I'm classified as a generalist counsellor. However, I do use my art therapy within that setting. So, as much as they're happy to have me on board, there's not really a classification as such with my employer as an art therapist.
Okay. So you're another person who's employed probably because you're an art therapist, but you have to go under a different job title.
Exactly, and that's been my whole work history. So, since I've attained my master's, I've actually worked at a CASA as well.
Mm-hmm.
Doing counselling and doing a large cohort of children, establishing group work, all using arts creative therapies approaches, so, which is really interesting, but within that, still not employed as an art therapist.
And so at the CASA, you would have been working with children who'd experienced sexual abuse.
Exactly.
Mm-hmm.
So I've done that whole trauma, and that was with children and adults as well. So and the group that we worked on setting up was actually based with adults, but using art therapy. So,
And yeah, can you say anything about how art therapy is especially suitable when we're working with young people and also people who've experienced trauma?
well, it goes back to all those trauma-based, trauma-informed work, really, because the trauma sits within other parts of the brain. It's not a cognitive thing that we're working with. So if you're only dealing with that verbal um, therapy basis, you're actually only working on one level of processing,
Mm.
which is the more cognitive based stuff. So once you go into the more underlying things, and the trauma occurs in a sensory and kinesthetic way, people feel it, they hear it, it's in those real survival modes of the brain. That's how they cope. Then it's not something, the logic and the all that meaning making comes later, but to tap into that and to find ways of processing it, I've found it fascinating to see how people can go to a different level by using something creative, and sometimes very quickly.
Mm.
Yeah. And I do private work too, so I'm navigating different spheres, but what spaces as well, using the art therapy, but always not really apart from my private practice as an art therapist per se. So there's that lack of acknowledgement of what we bring,
Mm-hmm. Mm-hmm.
and then finding sometimes that even though, yes, they welcome art therapy, that quite frequently there's still a lack of understanding about what we actually bring.
Mm, for sure. And so, why is this petition so important at this particular
Well,
point
I
in
think
time?
that relates to what I was saying. It's that lack of acknowledgement,
Mm.
and it doesn't really then value us, our modality, our profession. It's really it degrades it, or makes it less valued in some way.
Mm-hmm.
And when we're looking at all this talk, particularly at the moment, about mental health being so important, people connect through artwork. The discussion about an art piece or creating something together creates a whole different therapeutic relationship on such a different level. And it's, and by not recognizing us within the mental health sector, when really what you're looking at, counseling is about mental health. And I've also worked at Mind as well previously, so I've worked in mental health as well, but never was it recognized that art therapy as a profession was important within that.
So now's the time. We have a mental health emergency and we have a willing and skilled up workforce. Let's see if we can get that definition changed.
Yeah, I believe it's necessary. And even within the private sphere, so within my work at La Trobe Community Health Services, I've worked within schools as well. But again, you've got that whole component of you come there, oh yes, it's brilliant, you're doing all these things, but it's still not recognised that art therapy in its own right is also a mental health profession.
Okay, well, let's see if we can help make the change. Thanks so much for your time, Maya, and telling us about your work, and thanks for doing all that wonderful work.
Thank you.